myself Dr. Pooja Bansal, Consultant Gynecologist at Nerul, Navi Mumbai. Today I'm here to talk about a very commonly seen but very less addressed topic, that is PCOD and mental illness. Now, mental health in PCOD is a very untouched topic because we see it very often, but we are not addressing it, we are not treating it, or we are not considering a part of PCOD. Now, what are the causes of mental illness in PCOD, including that you have depression, you have anxiety, and different issues. In PCOD, there are n number of hormones which are contributing to the hormonal imbalance. Very commonly seen is raised in androgen. That's a male hormone which is most commonly seen raised and responsible for most of the symptoms, including acne, hair fall, hirsutism, irregular cycles, and obesity. All is the symptoms and part of PCOD. The second is insulin imbalance. So these two are the primary cause of hormonal imbalance, and this is also considered to be primary cause of mental health issues in PCOD. Most of the women who are having PCOD get stressed about their diagnosis, about their appearance, about their body image, about their symptoms, which are very radical. They're mostly young girls who have body image issues, so they tend to get very disturbed mentally, and they tend to fall into the depression and anxiety. How can we address it? The first and primary thing is to notice. We want to address this issue beside that, okay, you're having regular cycle or not, because most of the patients who walk into my OPD are only talking about the appearance of them, or only talking about the cycles they have irregular or heavy, but most of them are missing the mental health aspect, which they don't want to talk about. So the first foremost thing is that we should be addressing that issue, because that is a very significant part of PCOD. How can we improve the mental health of a PCOD girls? The first and foremost is that any one of you who are having such a difficulty in coping up with the symptoms, coping up with the diagnosis, or related infertility issues, you should be talking about it. You should be telling your relatives, husbands, or parents around you, your loved one. First thing should be addressing the problem, right? The second is you seek help of a medical professional. It could be a gynecologist, it could be a psychiatrist, it could be a counselor. So seek help for your needs. Third is that we give the importance to ourselves. Okay, so if the moment you start addressing yourself first, the moment you start taking care of yourself, you start to come on track, you start feeling good. So that is the one very important factor. Next, we should be definitely doing certain kind of exercises. So when we exercise, it definitely releases good hormones in our body, and that can give rise to reducing the stress level. It can give rise to the feel good factor, and you may not really get into the mental aspect of the disorder. Next, most commonly and most effective thing is seen as any kind of meditative activities. Okay, so that definitely helps to improve ourselves, improve the thought process. It really distracts you from the constant thought of that you're diagnosed with PCOD, or you're not going to delay it with the pregnancy, or XYZ. All that social stigma, all that body image issues can be tackled. Healthy lifestyle, healthy diet definitely plays a very big important role. It doesn't even play an important role in maintaining your mental health in PCOD. It plays a very important role in maintaining PCOD itself. So most of the women who are walking to me, or girls are walking to me with the PCOD, I generally said to maintain a very good lifestyle, because there's no particular medicine which can be really preventive and really helpful to prevent PCOD, but definitely if we are maintaining a lifestyle, that can contribute in the long run for the betterment of your symptoms and outcomes. So I will definitely suggest that we should be addressing this topic We should not be shy talking about that. I have been diagnosed with PCOD. I do suffer from a lot of depressive thoughts or low moods and anxiety and insomnia. So definitely you should address this, and together we can definitely make a difference. Thank you so much.